Hi, my name is Shelby Bates, and I created this PowerPoint with my fellow classmates Whitney and Trini about Mycoplasma. We will go over Mycoplasma in detail, what it is, basically clinical signs, treatment, prevention, if there's any, how it's transmitted, and even the species it affects. So what is mycoplasma? Mycoplasma is the smallest prokaryotic microorganism that is capable of self-replication. It does not stain by the Gram method, and it does not replicate in the environment. It is resistant to certain antibiotics like penicillin that interfere with synthesis of bacterial walls. It's commonly found on the mucosal surfaces and is host specific. Typically, the microcolonies of Mycoplasma can have a fried egg appearance. They also are susceptible to desiccation, heat, detergent, and disinfectants. Some of the domestic animals it affects are your ruminants, so your cattle, sheep, goats, and there are ones for sheep and goats. Also your pigs, and then there is a Mycoplasma in cats. And then you also see it in your avian species, so chickens, turkey, and poultry. I will say out of all the species that it does affect, Mycoplasma haemophilus in your cats, I tend to know a little bit more about. And you're going to know more about this one in your general practice for small animals, more so than your large animal, unless you're in a strictly large animal facility dealing with your cattle and sheep and goats. One of the main mycoplasmas that we'll discuss is your contagious caprine pleural pneumonia. So this is something that is caused by the Mycoplasma capricolum, or subspecies Capra-pneumoniae. It is a highly fatal respiratory disease in goats. It is found typically in the Middle East, Africa, and Asia areas. It is a pneumonia and pleural pneumonia. You also can see joint and udder infections, and their incubation period can be anywhere from 6 to 10 days. Also can range from 2 days to 4 weeks. It is typically transmitted through aerosolization with close contact of infected animals. And it's most commonly seen when you're introducing a new goat to a flock. Your diagnosis is based on your clinical signs, but you also have necropsy that's used to establish a diagnosis, and your PCR. Your PCR will be your polymerase chain reaction. Samples are taken for it directly of the pleural fluid or the affected lung. It has made it easier for a diagnosis of mycoplasma. You also have your serology testing, so your complement fixation, your passive immunoagglutination, and your ELISA. ELISA is typically what you think of with some of your other serology testing. Also, you can do a latex agglutination in fields. Your serology testing is your most common would be your passive hemagglutination. This basically is red blood cells used to absorb the soluble antigen onto their surfaces. The red blood cell then agglutinates in presence of anti-serum specific for that absorbed antigen. Your clinical signs are going to vary from acute to subacute and chronic. Your acute is generally they can die within 7 to 10 days. You'll typically have your initial signs of fever, so fever 106 to 109, weakness, lethargy, anorexia, followed by coughing and labored breathing. Typically, you'll have exercise intolerance eventually, then may lead to open mouth breathing, but it's going to be a violent cough and very productive. Then leading to your final stages, they may not be able to move well, so they have that stiff neck and that wide stance. So they stand with their front legs wide apart and their neck stretched out, stiff and extended. And then to your terminally ill patients, they'll frequently have that frothy nasal discharge and stringy saliva. And then you can have abortion in your pregnant goats. Now, your subacute and chronic, you're going to typically, they're milder than your acute cases, and they are going to have cough after exercise, that nasal discharge, followed by that fever, so 104 to 106. And typically they can continue with the fever. Treatment and prevention. So you're going to have vaccines that are known to be good protection against the Mycoplasma capicolum. You will have antibiotics that you can use, so your Tylosin at a 10 mg per kg per day, intramuscular for 3 days, and then your oxytetracycline, so your 15 mg per kg. Most beneficial would be your quarantine of affected flocks, so taking out those flocks that are infected, because obviously your transmission is through aerolization, so having all those in an area is going to obviously increase your chances of spread. There is no evidence of zoonotic tendencies, and your quarantine outbreaks have occurred in, the endemic regions where apparent healthy goats were, introduced into the flock. So Mycoplasma diseases in cattle are going to include your Mycoplasma mycoides. It is a contagious bovine pleural pneumonia, so severely contagious. It is transmitted through aerolization. And your signs typically include fever, anorexia, depression, coughing, labored breathing. Treatment and control. So in exotic regions, slaughter of the infected and in contact animals is mandatory. And then your endemic regions, control strategies include prohibited movement of these possibly infected animals, and then mandatory quarantine and elimination of any carrier animal. Annual vaccines help to control the severity of the clinical signs, but like any other vaccine, do not prevent them from getting it. Prognosis, your mortality rate can be high. Reportable disease by LACE. Another mycoplasma would be your Mycoplasma bovis in cattle. It is worldwide. You're typically going to have your mastitis, your pneumonia, and arthritis. It can affect other main organs as well. It is transmitted animal to animal through the close contact of those bodily fluids. So your clinical signs, so your mastitis, you're going to have that swelling, that heat and pain and redness in those areas. Your pneumonia, so your chronic bronchopneumonia, and your arthritis, so your lameness. That, like I said before, they can affect other main organs such as the eyes, the ears, brain. They can include anywhere from keratoconjunctivitis, suppurative otitis media, meningitis, and they can cause severe pneumonia in calves. Mycoplasma can also exacerbate respiratory disease caused by Pasteurella and Manila. Transmission on the farm, so your animal So of those bodily fluids, that mucus and that milk equipment, calves can get infected from drinking milk from infected cows. Urine and feces not regarded as significant transmitters of disease, but bacteria does survive longer in moist environments. So those pile of moist feces and even wet bedding. Off the farm, movement of cattle from farm to farm, and even your farm equipment, so your AI equipment, so your artificial insemination equipment. Your treatment and control of Mycoplasma bovis, so your respiratory disease. You're going to treat with antimicrobial therapy, your NSAIDs to reduce that fever, although response to treatment is usually poor in severe cases. Main thing controlling would be minimize the movement of cattle from farm to farm. The impact it can have, these diseases impact the food animal industry. So causing that mastitis that does not respond well to treatment, you're going to have those late-term abortions. It is not a zoonotic disease, so there is no zoonotic potential. Next is your Mycoplasma haemophilus. This was considered at one time, it's feline infectious anemia. It is found worldwide and is commonly among free-roaming tomcats between the ages of 1 and 3. Your clinical signs are going to include fever, anemia, depression, weakness, jaundice, and some may be asymptomatic. But typically when you have that cat come in who's just very weak, lethargic, and you know it's an outside cat, stray, someone just picked up trying to take care of, that's the first thing that comes to mind to think of personally when they come in the clinic. It is transmitted through bite wounds, so that's why a lot of your tomcats can have this. It is possible to be spread by arthropods as well. Typically, diagnosis is going to be your PCR analysis, but you can do blood smears to identify the Mycoplasma haemophilus on erythrocytes. Treatment includes doxycycline therapy for 21 days. Can help with symptoms, but it is not a cure. Typically, you're going to have supportive care and early diagnosis to really help the patient, and symptoms may regress and return, making them an asymptom lifelong carrier. And these include our references for our PowerPoint, but in general conclusion, we've learned about 3 main mycoplasmas today that do affect your large animals, so your cattle, your goats, and your cats.